Well, we think about cancer treatment as having three main potential tools that can be used. So, surgical oncologists are surgeons with a particular background of training that use surgery to take out tumors. Medical oncologists use systemic therapies, both chemotherapies and targeted therapies, to address tumors. Radiation is similar to surgery in the sense that it's a local therapy. And things have changed. I think that's the most important thing to know about radiation. That radiation that was available 10 years ago, 5 years ago, the technological advances make both the choice of radiation doctor and the specific set of tools that are available to use radiation with the goal of cure are different today than they were before. So the equipment matters, but so does the judgment of the radiation oncologist. I meet people often who are very frightened of radiation, and I think part of it is that you have an idea about what a surgery is, you have an idea about what chemo is, but many people really have no framework to understand what radiation is. And it leads to fear about the idea of radiotherapy. And I think what I'd like people to know is that those fears, which are based on making sure that there's not short-term symptoms or long-term dangers, are considerations that are really at the core of what I do every day. And so I too want the best technology. I too want the best judgment. I too want the absolute maximization of all the opportunities we have to minimize the impact of radiotherapy on the patients upon which we use it. And so getting through that fear and coming and having a discussion about it to help patients and their families understand not just the logistics of care, but also the implications of that radiotherapy. I find that it's another circumstance where that uncertainty takes on a more frightening overall impact, wherein you can use information, education, and an understanding that I and the patients I care for have the shared interest of having absolutely the highest chance that the radiotherapy won't result in harm. That's a commitment that I share with patients.